I just want to thank you guys for coming this afternoon to Be Prevention, Advocating for a Stronger New Hampshire. I'm Karen Pellicano, and I work in the Programs Department at New Hampshire Children's Trust. And I hope that you've been able to join us for some of the other webinars we've done this month, because we've had a really active Child Abuse Prevention Month, and this kind of ties everything together. We've talked about the importance of relationships and the importance of building a strong community. And today we're turning to New Futures to give us some practical tips about how to advocate for yourself and your family and the important issues in your life. And I've been to a few trainings with Rebecca, and I always come away energized to keep up the good fight and to remember what's going on in the world around me. And so I hope that you can take that with you today, because this is always a really energizing topic for me. So I want to take just a couple of minutes to thank our Child Abuse Prevention Month sponsors. We have the New Hampshire Department of Education and Dartmouth Health. And if you've been able to join us for any of the activities this month or the webinars this month, you can really see how much their support means to us and to New Hampshire families. So we want to thank them for that. And just as a heads up, I'd like everyone to know that this presentation is being recorded. And so if you enjoy it, it will be available on the NHCT website, and please share it with other people. All of the webinars this month actually have been recorded, and they're all available on the website. So if you would like to find those and forward them on to people, that would be great. And also, we're going to have a question and answer section. We'll have that at the end of the presentation, but if questions come up while you hear Emma and Rebecca speaking, then please just enter them into the chat. There'll be an opportunity to come off of mute at some point. So I'll keep an eye on the chat, and I think that Janet, who is working with New Futures, can also keep an eye on the chat and make sure that those questions get asked as they're appropriate. So I would like to take a minute to introduce Rebecca Woitkowski, who is the Kids Count Policy Director for New Future, and Emma Sevigny, who is the Children's Behavioral Health Policy Coordinator for New Futures. So thank you very much for joining us. And if you guys would like to introduce yourself, that would be great.
Great. Thank you so much, Karen. Hi, everyone. I'm happy to be with you today to talk a little bit about how you advocate for New Hampshire's children. As Karen said, I am the Kids Count Policy Director at New Futures. What that really means is that I monitor and advocate for children and families on behalf of New Futures, but really on behalf of every child and every family that doesn't have an empowered voice. We advocate for policies that are important and improve the health and wellness of our youngest, but very important part of our population here in New Hampshire. And Emma?
Hi, I'm Emma Sevigny. I am the Children's Behavioral Health Policy Coordinator here at New Futures. And so I focus my area of advocacy on children's behavioral health, ensuring that our system of care is growing and advocating for better services for our children.
So Janet is with us today, and she's going to be running our slides. She's a community engagement coordinator here at New Future. So in advance, thank you to Janet. So whenever you're ready, Janet, we can get going. All right. So the question here today is, how do we advocate for New Hampshire's children and families? Next slide. So I think the first question you may all have, if you aren't familiar, is who is New Futures? What is New Futures? New Futures is a nonprofit, nonpartisan advocacy organization, and we really have a vision where our state and local communities have public policies which support the health and wellness of all New Hampshire's residents. And as Emma and I said, while we're in a larger organization, our focus is on children. Next slide. But that's not all the work that New Futures does as a health policy advocacy organization. We also work in these other buckets of policy within our state. Next slide. You may wonder, how do we do this? What do you mean when you say you're a health policy advocacy organization? We have three main areas that we categorize our work. We advocate, collaborate, and educate. Advocacy, in a traditional sense, as shown in the first picture, is when we're over, State House is right there, when we're over advocating to our lawmakers about what policies make sense for our state and how we grow services for families. We also collaborate, which is kind of like today, working with our great partners at the Children's Trust to work together to increase advocacy skills within the community and information. That also branches over to our third category around educate. We offer a robust training program that we go out into the community and help folks understand not only how to advocate, but what's going on in the legislature that may or may not impact them, that impact a family's daily life. Next slide. Oh, I forgot we have motion. So here's a little bit about our training program. If you're interested, you'll get these slides afterwards. There's a nice little link, and our folks here can help you decide if you want to attend a training or build a training for your own organization. Next slide. And also a thank you to our funders. These are the funders which support our work. We are very lucky that we do not receive any state funding from organizations, so we are able to really advocate for all kids and families. We do receive funding from philanthropy, both state and national. If you have any questions, feel free to ask me afterwards. All right, next slide. Why does early childhood advocacy matter? Some of you may come to this training with a robust understanding of early childhood development or brain science of kiddos, but many people don't. I know that when I took this job about 5.5 years ago, I knew nothing about really what adverse childhood experiences were. That is the definition of ACEs, as well as what was happening in a child's brain as they developed. This is my favorite picture of or visual representation of what we mean when we say ACEs. So as I said, New Futures is a health policy advocacy organization, and advocating for children might not necessarily come to mind as a direct correlation. What underpins our work is an understanding of how adverse childhood experiences. So in this visual, everything that's part of the tree happens in the internal family, and then adverse community environments, that's the roots. How that impacts a child's lifelong health, not only their mental health and physical health when they're in that family, but when they grow beyond that family into adulthood. Science has shown us again and again that these types of experiences, as they accumulate, can have a negative impact on a child's life. But next slide. This goes into, sorry, one more ahead. This shows a little bit more detail of the ACEs study. But what we know is that we actually, through simple interventions, can prevent and mitigate the impact of those negative experiences in early life. And I love also this visual, because the ways in which we help intervene and mitigate the impact of ACEs is really looking at a 2-generational approach. It's using protective factors. And so these are the things that New Futures advocates, and why it's so important that we do advocacy for early childhood, because we know the more the state invests and communities invest in protective factors and interventions that mitigate the impact, the healthier our population will be, and our children are our future. So ensuring that they have everything that they need for healthy development is really a keystone of our work. Next slide. So you understand, or I've told you a little bit about why we do this work and why it's so critical and important. I just want to share this slide to kind of show that when we think about advocacy, Emma's going to talk a lot about our legislature, but we're also advocating within a system that is administrative. Just before the pandemic, Governor Sununu created a new early childhood structure. This was really supported by New Hampshire receiving a grant called the Preschool Development Grant. It's a misnomer. It has to do with coordination for families, not just the development of preschool. And the Council for Thriving Children was created. Internally, the Council for Thriving Children sought to reduce silos with the external. So there's a parent-led organization, a Center for Excellence, and then internal silos in the Department of Health and Human Services and the Department of Education. I offer this up as, I'll discuss it as a point of advocacy for our children and families, and then a point of growth for our state, really starting to understand that we need to ensure that the system we are creating is accessible for all, it's equitable, and that much of the advocacy that has gone on for the past 5.5 years, namely, has had an impact to raise the issue of early childhood investments to a place that has garnered a lot of attention. So I'll talk more about this later, but Emma, I'm wondering, could you talk a little bit about what our New Hampshire legislature looks like?
Sure. Janet, if you want to go to the next slide. So I'm going to be chatting about what our New Hampshire legislature looks like. And Janet, if you actually want to move to the next slide, sorry. So it's a part of, the legislature is composed of two bodies. There's the Senate, which has 24 representatives, and then there's the House, which has 400 representatives. And these bodies work together to create laws that will eventually go to the governor to be either signed into law or vetoed. Next slide. So legislators are made out of community residents of New Hampshire. So they are anybody that's walking down the street in New Hampshire that lives here, it can be a legislature. There are volunteers, generalists, and your neighbors. Next slide. The legislative session runs from January to June. It is every 2 years. There is a new election cycle, so there are new legislators elected. And the first year of each biennium is a budget year. So we right now are in the second year of the biennium. So next year will be a budget year, and this year we'll elect new officials to take part in our legislative season. Next slide. So the Executive Council is another arm of our legislative body. So we've got the Senate and the House, which are part of the legislative branch. And then there's the executive branch, which is comprised of the governor and the Executive Council. There are 5 executive councilors. They're also elected every 2 years. And they work with the governor directly to check and balance his powers. They have the power to approve appointments of judges and commissioners, among other department heads in the state. And any state contract that is for over $10,000, they have the power to approve or deny as well. Next slide. So how a bill becomes a law, there's a lot of steps to this, but it's pretty simple when you really break it down, and this graphic is great. So it starts with an LSR, and this is just a proposed bill that a legislator has drafted, and then it goes to the language is released, and that becomes a bill, and it's assigned a bill number. From there, the bill is assigned to a committee, and the committee hears testimony from advocates on whether this bill is a good idea for the community. The committee has the public hearing and then decides in an executive session if they want to pass the bill as written, attach amendments, anything like that. From there, it goes to a full body vote. If the bill starts in the House, it is voted on by the whole House. If the bill starts in the Senate, it is voted on by the Senate. If there's what's called a fiscal note attached to it, meaning that the bill has some type of a financial impact on the state, then it'll go to a second committee, usually the Finance Committee, and there's another, typically sometimes a public hearing and then an executive session. So that little cycle goes until the bill is fully decided on one side of the legislative body. Then it crosses over to the other side. So if it starts in the House, it goes to the Senate. If it starts in the Senate, it goes to the House. And then the process starts again. So it goes to a committee, there's a public hearing, and then they have an executive session to vote on it, and then a full body vote, and then it goes to another second committee if needed. If the second body, so if it starts as a House bill, let's say, it goes through this process, goes to the Senate, and then the Senate changes the language of the bill through amendments. The House gets a chance to review it again, and that's called the Committee of Conference. And that's a committee in which both the Senate and House has representatives, and they come to an agreement on what the final bill language will be. From there, once the bill has been adopted, it goes to the governor to be signed, or if he vetoes it, it can be revived by 2/3 of a vote. And then it would become a law as well. Next slide. So this is a screenshot of the general court website. This is where you can find all sorts of great information on the legislative process. So if you have a specific bill you're following, you can search that bill and a docket will come up that explains exactly where in the process that bill is and how you can jump in at a public hearing or some other level of advocacy. You can also very easily find your senator and representatives and contact them with any concerns or questions you have about a bill. Next slide.
Great. Great, thanks, Emma. So I love that you went through all those stages because I think that the process of thinking about how a bill goes through the legislature can seem very confusing for most people. But I love highlighting that there are so many opportunities for advocacy. And, you know, I appreciate Emma setting out what the legislature looks like, because I think when we think about how we're going to advocate and we're going to talk to our lawmakers, again, there are lots of different leverage points to which you could have a conversation. I also want to make sure that I really emphasize what Emma said about the members of our legislature are members of our community. They are not career professionals, so to speak, because they don't make very much. It's $100 a year. So they're really doing this because they have a commitment to their civic duty, or this is, you know, an aspect of their life they're able to commit some time to. Just on that tangent, I will say why it's important that we have folks like you advocating for kiddos. Most of the individuals who serve on our legislature are not moms and dads with little children. It's extremely time consuming. So it's really important that we are developing advocacy skills so that we can share our story, which is the transition to the power of the personal story. Next slide, Janet. Great. So being able to speak with a member of the legislature may seem intimidating. We have worked with a lot of folks to figure out, you know, what is the best way that we help individuals understand how to develop their story, because your story is so important. I could be speaking with a member of the Senate or the House at length, and it wouldn't have the impact that your 2 minutes in front of a committee hearing or phone call may have on that lawmaker, because you come from their constituency and you represent a genuine voice of the community in opposition or support of a bill. So provided in the slides today is really the format for telling your personal story. So it is always 4 points. Introduction, introduce yourself. You can go ahead, that next slide is great, Janet. Introducing yourself and any important information. Generally, if you're calling someone from your district, you would identify where you live, you know, your background, whether you're a parent of young children, you're a grandparent caring for young children, and, you know, what else brought you to call that representative. Next slide. So generally when we're calling, we're talking about a challenge. So say you are a grandparent and you're caring for your grandchildren, and you know you're calling because you say accessing childcare is exceptionally difficult for me because it is expensive and it's not available in my community. The key point here is you should lead with your challenge, but just don't stop there. Next slide. We really want to talk about solutions. So in that framework, if you're a grandparent calling and you're talking about the challenges with childcare, you know, your solution would be, I'm really advocating that the state invest federal dollars into childcare to, you know, deepen the subsidy eligibility so that I could qualify. It would really help for, you know, my family and also my grandchild's early childhood development. Staying focused on the solution really helps carry your story over the finish line. And next slide. And you can also say that, you know, you're most impactful when you indicate that, you know, what you're calling, what you're speaking about just doesn't impact positively your family, but it ripples throughout the community. Again, very simple. It can feel very intimidating, but it is not. I will tell you that although there are over 400 members of our legislature, they do call you back. So we'll talk a little bit more about, I'll have Emma talk about examples of advocacy and how we do it. But if you use this 4-part breakdown or outline of how to tell your story, it provides confidence that you're going into the conversation from a strong point, and it also is really, really impactful. So Emma, can you talk a little bit about ways to advocate?
Sure. Thanks, Rebecca. I think it's really important to know that when you are advocating with your story, you are really doing a huge service, not only to yourself, but to your community at large. And there are so many different time periods at which you can advocate during the legislative process. And there are so many different ways you can advocate. So some of the common ones that we do all the time are calling legislators, testifying on bills, and getting our stories across that way. And that's how we a lot of times help our advocates craft their story to present to legislators. But there are a bunch of others. You can have a coffee with your legislator, because there are so many in the state, and because we are really a small state, a lot of people know your legislators and have a relationship with them, and you can just sit down for coffee and explain your story and why this bill is important to you. You can also attend events or rallies. Other really cool ways are producing letters to the editor and getting them published in your local paper. Representatives and senators are constantly looking to local publications for indications on how their constituents feel about a certain topic. You can also advocate on social media, help garner attention to an issue, or just emailing your legislator. It's just as important to, send emails and keep up the fight, even if you have testified and called your legislator and had conversations with them. Having that reinforcement of an email to look back on and review, if they have questions and need information that you've provided, they can easily do that in their email. Next slide. So like I mentioned, calling your elected official is probably the most effective way to reach them and get your story across. It's a more intimate way of chatting with them than in a testimony. And it's a really fun and easy way to get involved. So the best way to start is to prepare bullet points or a script so that you are on topic and know what you're going to say. And it's best to keep your message concise. The elected official you're speaking with probably has a lot going on. So the more effective you are and quick you are to get your message across, the better. Next slide. And finding your elected official's contact information is pretty simple, and we're happy to help if you ever have questions. But the general best practice is, if you're looking for your federal representatives, you can contact them through your, you can go to the federal website for either the federal House or the federal Senate and get their contact information there. For the state, we have the GenCourt website, like I showed earlier on the slide, and they have a very easy way to just pop in your zip code and it'll pop out your representative and their contact information right there. If you're looking to contact the governor, the link is right there as well for you to get in touch with him. Next slide. When you are emailing an elected official, there are a lot of emails that they are getting. They remind us frequently, but this is still a really important tool for us when we are advocating. And like I said, it's a great way to follow up with your phone call or your testimony to reinforce some of the points you had made. So what the best practice is when you are emailing them, you can email the elected official and put in the subject line, so it's very easily called up, your name and constituent of the town and the bill number and the issue, so that they know exactly what they are getting an email about. And if they want to look back and see what type of contacts they've had on this, they can easily search just that bill number or the issue. Next slide. Sorry, Rebecca, do you have something you want to say?
No.
Oh, sorry, you can jump in at any time. Public hearings in 2022 are a little different than they have been in the past. So previously, before the pandemic, everything was held in person. during the pandemic, everything was remote, and now we have a bit of a hybrid model. So there is no option for remote testimony. If you want to testify, you have to go in person, but you can submit written testimony online, and you can sign in support or opposition of a bill online. This is all found, and links to this can be found on the Gen Court website as well. Hearings are being live streamed on YouTube, so it's super easy to just hear what's going on if you're interested, but maybe not willing to go in person. And you can remotely sign in support or opposition if you are not comfortable going in person. Next slide. And I think Rebecca, if you want to jump in.
Sure. Yeah. So as Emma said, right now you cannot testify remotely, but you can submit your testimony in person. We always include this slide to show that this is what the screen will look like if you wanted to submit your testimony online. So you can upload, you can indicate the committee, the date. Really tricky, make sure you pick on the date first, or nothing will auto-populate in the bottom until you've done that. You'll select the committee, your bill, they'll ask you if you're a lobbyist, an individual, and who you're representing. That's just to ensure that they know who's submitting the testimony. You can say you support or oppose, and then you have the option to upload a PDF of your testimony if you want to. The other thing I'll say is that you can do another search too if you're interested in a bill. For the House, at least, they will tell you how many folks signed in support, opposition, and they will link to the testimony that was submitted if it was submitted online. It is important to remember that this is really great. This is a development from COVID to have extended ability for folks to participate even though they can't be there. It is still not, we're still not sure what the collective impact of this is yet, because it's not always listed in a hearing about the number of individuals from the public who signed in support. I know that our lawmakers take it into consideration before an executive session, but I will say if there is a bill that is very, very, very important to you, connecting with agencies like New Futures or others who are there at the State House is really important to ensure that your voice is heard on a particular bill. Next slide. So let's talk about what you do if you were testifying in a public hearing. So there's a bill that's very important. You want to be there, you're able to. Every bill in New Hampshire gets a public hearing in both the House and Senate. Now, they don't always get a second public hearing, particularly in the Senate. If a bill has a fiscal note, so there's money attached to it, generally there wouldn't be a hearing in Senate, not a public hearing, that is. It is key that if you are testifying for about 3 to 5 minutes. I find that on average, I speak for about 2 minutes, and you're able to speak to a issue as long as it's not super complicated within that time frame. Always have bullet points for yourself or a copy of your testimony, and bring printed copies for the committee. You can submit written testimony. That is generally what we try and do. You will hear sometimes in a certain committee that they don't like when people read off of their written testimony they've submitted. It doesn't matter. If you are nervous and that is the way that you are comfortable going up there for your first time, I say fully do it. I did it. It is, as you get used to the process, it becomes more conversational. But anything that you need that will help keep you on point to speak. For the most part, our members of the legislature are patient. They'll give you time if you sign up. They have to allow you to speak. So, you won't get skipped over. If you are, I don't know if we have it listed here, but if you ever decide that you want to testify, I do encourage you to look for organizations that are aligned with your position on a bill. See if you can link up with them before going to the Legislative Office Building or the State House. It can be a bit confusing when you get there. If you're getting there to testify in person, even though you've signed in online, you still have to fill out a pink card or sign particular form so that the clerk knows, that they're going to call your name. So again, it's an easy process. It's just one that you have to get a little bit used to if you've never been there before. But I encourage everyone to at least try it once. It's an interesting experience. It's great opportunity to hear what your lawmakers are saying in their positions, and it helps guide, the work within your community. Next slide. So one of the wonderful things, you get kind of 2 for 1 if you should decide to testify or submit written testimony on a bill. It's easily converted into a letter to the editor, LTE. Letters to the editor are great. As you see, it's 250 words max. You submit it to a local newspaper or online, and it has a powerful impact. It goes beyond what is submitted or heard in a committee room, and really broadens collective understanding on your position on a bill. Next slide. We have conveniently provided submission links for local newspapers and a list of different places where, if you choose to write a letter to the editor, it can be submitted. Again, a great experience. You can then share it, through your social media or community, to show that you have been participating on an issue that is important to you. An opinion editorial or op-ed is a bit longer. Generally, it says here, usually written by an expert or someone with professional or lived experience. That is very true. Again, it has the same impact. It's just longer. Just because you are not a quote unquote professional doesn't mean that you can't do an op-ed. Often you can work with organizations like New Futures or NAMI to help you if you want help looking on how to write an op-ed, again, on an issue that's important to you. So I encourage you to reach out if that is something that interests you. It's a great way to advocate. Next slide. Social media. Social media, we all know we love it or hate it, but it's here, and it is a good way to spread brief bits of information. Using a hashtag is really important. You can share out information from the Children's Trust or New Futures, or that link to the op-ed that you did, or your testimony. So again, it is a way to advocate. When you choose to share something that another organization has put out, that's advocacy. It's very simple advocacy, but you are, again, increasing public awareness and collective knowledge on an issue. Next slide. All right. So I'm going to pause for a quick second and see if anybody has any, big questions that they would like to ask before Emma and I talk a little bit about what is going on in the New Hampshire legislature around some key bills in early childhood and children's behavioral health. All right, since no one's chomping at the bit, we'll move on and then open up at the end for some additional questions. But as we've set out, the legislature has lots of bills that they have to consider every single year. There are lots of opportunities and points of discussion around what is the best policies for our state. New Hampshire has, New Futures identified a number of early childhood bills sponsored by various members of the Senate and House that are important for us to advocate. Today, as it would be, all of these are bills that New Futures support. So the green check is something that we are in support of and not in opposition. And I'm going to talk in depth about them for a little bit. And I'll give you a status update. You should know that where we are on that little board game that Emma described as crossover, going to the second half. The legislature has to be done with all their bills by May 26th. So we are in the second half of the legislative session, and a lot of decisions have been made. So the first bill is Senate Bill 144, relative to childcare scholarships. You'll notice that most of the bills that are filed have kind of really formal names. But what this bill really is a bill that directs the Department of Health and Human Services to do a pilot program that would allow families to be participating in our child care scholarship program on an enrollment-based instead of an attendance-based policy. this policy change was something that was tested during the pandemic. It was beneficial to both providers and families, and it's nationally something that is done in many states for a lot of reasons. First of all, it takes away the punitive nature of our child care scholarship program. Unlike parents who are traditionally full pay, parents on child care scholarship, if their kid is absent, exceeding the number of absentee days allowed in the program, they are charged more for that child not being in childcare. Now, given COVID and a lot of other reasons, your kid may have to be absent. I know my child care center, if my child has a fever, they have to be out, they have to be fever-free for 24 hours. So that really means like 2 full days before they can go back. It is punitive in nature to determine that our low-income families have to pay more when that happens. So this is a pilot program. It also would direct the department to, from that pilot program, determine how much that permanent policy change would cost. And then we could advocate for that to be included in next year's budget. Unfortunately, this bill made its way all through the Senate and then was voted ITL, which means inexpedient to legislate, or killed, in children and family law last week. So we'll have to see what happens with this important policy objective. We can still advocate for it in the next budget session, but one of the challenges is understanding how much this will cost. The budget session obviously is a financial deliberation, so we'll have to see how this policy change pans out going forward. So the other bill that was voted from that same committee and expedient to legislate is Senate Bill 326, relative to establishing Office of Early Childhood. This bill really directed the Department of Education and DOE to look at what would be a good plan to create an Office of Early Childhood. The Office of Early Childhood is a concept that has been around for a long time within our state. How do we better elevate and align early childhood issues to ensure that we have sustainable investments? It was an idea or directive as part of Governor Sununu's 2020 executive order that created the Council for Thriving Children. This bill was also voted and expedient to legislate, so we'll have to see what happens with that policy priority. The last one that was voted in expedient to legislate is Senate Bill 453, relative to statewide pre-kindergarten funding. This bill was, primary sponsor was Senator Tom Sherman, and this bill would have directed districts to provide universal pre-K to families, knowing that access to pre-K, there are equitable issues with that because of cost. Not all districts, we don't have any state funding. New Hampshire is one of 5 states that provides no state funding for universal pre-K. So unfortunately, this bill did not proceed very far this session. 2 bills, though, that I can say have done well is Senate Bill 407, relative to the expanding Medicaid to include postpartum healthcare services. So what that means is this bill would expand Medicaid coverage for new moms on Medicaid for 12 months. This is really a response to data which shows that moms suffer from health issues and mental health issues often longer than 60 days, which is the current duration of Medicaid post having a baby. So really important bill. This bill passed out of House Division 3 Finance unanimously. So we are excited about that. And then Senate Bill 446, originally this bill established a child care workforce fund. It was amended to direct the Department of Health and Human Services to create a plan and ask around a workforce initiative to try and utilize some federal funds. So this bill did pass, and we're excited to see what will happen when that workforce bill is developed. So I know that's kind of a lot about these bills, but each and every one of them have an interesting and complex impact. They reflect the priorities of our legislature and our communities. So if you're interested in hearing more about these bills or others, please let me know. I'm always happy to chat in the weeds about early childhood. But with that, I'm going to pass it to Emma to talk about some really important children's behavioral health bills.
Can I jump in with a quick question that came up while you were talking about that?
Yes, please.
I have 2 questions that came to me in the chat. For SB 453 that was voted down, how soon will that come up again to be voted on again? And do the votes typically change in between?
That's a really great question. So there's a really funky rule. So if a bill like SB 453 had been introduced last year and it had been killed, it couldn't be reintroduced in the same form the following year. But because we're in the second year of a biennium, that bill could be reintroduced next year by the same sponsor in the same format. So as we move into a budget year, it may be. The only other disclaimer I have is that the bill is only introduced if there's political will to do it. So if there's a sponsor that is eager to do it, and there are advocates that are supporting that sponsor and submitting that bill. So I would say, given conversations on a national level and internally, likely there's probably going to be more discussion about pre-K as we go forward next year.
Thank you. The other question is, when you are trying to use the legacy media in New Hampshire to advocate for legislation that protects children and strengthens families, which companies and organizations are the most receptive to your media pitches?
I think that all depends, and I know that's the worst answer to give you. We have had a lot of luck in, Concord Monitor. We have had good luck in Union Leader. I think it matters that you look to, if you're a constituent and you're writing an op-ed, you're submitting it to places where you live as well as statewide. And then, I think also looking if that, if the Concord Monitor, say, had done or published an op-ed in opposition to a bill that you're supportive of, that may be an avenue to consider submitting yours as it balances the viewpoints that are being shared through the newspaper. And then also being cognizant of if the newspaper has submitted or published a couple of op-eds on the same topic, they may not do a third one because the media is saturated on that issue. We are always happy to help advise if folks are interested, but it's always better to submit to more and see where it goes. But again, we have better luck, or we've had good luck when our advocates do that.
So I'm going to, similarly to Rebecca, unless there are any other questions, and feel free to jump in, go over my children's behavioral health bills that we've been following as priorities for this session. We followed a lot of bills, so if you have specific questions on anything that relates to children's behavioral health, feel free to reach out. The first two bills I'll go over are ones that we have opposed and are currently opposing. So the first one is House Bill 1431, which establishes a parental bill of rights. In theory, this sounds like a great topic for a bill, sounds like a great idea to get behind. But unfortunately, this bill would remove community protections for children. It gives parents the final word on their children's health, education, welfare, and even if it puts the child at risk or danger. So the bill has a lot of different components. The first major component is that it changes the way schools and parents interact. A lot of the protections that are lined out in the bill already exist for parents to look over course materials that their students may be exposed to and have an open dialogue with the teacher or administration to go over those. This bill instead changes that slightly to a more inflammatory process, which puts children at risk of losing out on important social and emotional educational opportunities. It also puts parents and educators at odds in a way that children suffer. So it sows a distrust between a teacher and a parent, and it sows distrust between administrations and parents. Additionally, it creates a lot of concerns for child welfare and child protection. The bill essentially makes it so that parents are the only people children can go to if they're having questions or concerns, because it creates that barrier between teachers and children. Schools are a great resource for kids to express themselves, to learn more about their world around them, and also express if they have things that are bothering them. By taking away that avenue for kids to express concerns, there is the concern between and among child welfare advocates that this may increase the ability of parents to harm their children. So we are opposing the bill as written, and currently it has passed the House entirely. It's passed the Senate committee level and is going to a House or a Senate floor vote shortly. So keep an eye on that one and let me know if you'd like to advocate. House Bill 1639 is another bill we're opposing this session. This is relative to the youth risk behavior and survey, the youth risk behavior survey in schools. And this is a really important survey that schools give every 2 years to high school students as a means to track their health and wellness behaviors. So it does ask questions about sexuality, sexual practices, drugs and alcohol use, but it also talks about things such as healthy eating practices, exercise, and those types of things. And this is really important data for schools, police departments, community agencies to examine what children are facing as unhealthy practices in their daily life and what children are doing that is healthy and how can we encourage those behaviors. So this is a really important tool. The bill as written was changing the survey from an opt-out survey. So parents could at any time say, I don't want my child participating in this, please don't give them the survey, to changing it to an opt-in survey. And so what that means is a parent would have to sign a permission form essentially for their child to participate. This would reduce participation. As we heard during testimony from many folks, parents are busy, kids are forgetful and busy, and things slip through the cracks very frequently. If they needed to return a permission slip to do this, participation in the survey would likely go down to such a low level that the survey results would not be valid. And when we don't have the valid data and results, communities suffer. Not only are we unable to plan programming tailored to the specific and unique needs of a community, but a lot of grants and funding that the state gets for drug prevention, health and wellness prevention, and encouragement programming comes from applications that use the YRBS data. So this is a really important tool that we want to keep intact. Just this morning, there was a Senate committee executive session, so a vote to amend this bill. Once we have the amendment language in hand, I'll be able to tell you if we have a new position on this bill or if we're going to continue amending it. So stay tuned for that. The other two bills I want to talk about are bills that we are supporting. Senate Bill 416 is an excellent way to advocate for expansion of the system of care and making it a more robust system for our kids. So Senate Bill 416 is relative to behavioral health assessments and treatment for children in out-of-home placements. What this bill really does is it just asks that children where it's clinically inclined or recommended who are at risk of being placed out of their home due to behavioral concerns or anything related to their behavior receive what's called a functional behavioral assessment. And this just is a way for a mental health practitioner, usually a behavioralist or a psychologist, to review records for the child and review and monitor the child in their environment to determine what the root cause of their problem behavior is, and then create a positive intervention plan so that there's a direct cause and treatment for making this behavior no longer a problem behavior. And so this would reduce costs and reduce the likelihood and length of children having to be placed out of their homes. Currently, this bill is in Senate Finance. It did have a hearing yesterday, and it's continued today. So as soon as I hear out of that committee, I'll be sure to update folks as well. And then finally, Senate Bill 444 is a joint effort between me and Rebecca. It is relative to childhood adverse experiences, treatment, and prevention, which we talked about at the beginning of this presentation, so ACEs. And this bill does three main things. It provides for a pilot program for children and families who have experienced trauma to receive more services. It provides for an appropriation to build out the system of care and expand child and parent psychotherapy, which is a evidence-based practice to ensure that children and family systems are working together to overcome a traumatic experience. And then finally, it provides for an appropriation for family resource centers, which are a really important tool in our communities to help connect parents with resources, but also provide support and education to parents. So that bill again passed unanimously out of the Senate work group yesterday and is going to be going to the full Senate Finance Committee or House Finance Committee, excuse me, I believe tomorrow. So keep your eyes peeled for that one. Thanks, everyone.
So I have one more question that came in chat.
Mhm.
Is there a way to get new futures updates emailed to you or texted to you on a particular bill of interest?
I think that that is a yes and a no. So you can sign up to get new futures action alerts on particular categories of bills. So, you know, if it's children's behavioral health or early childhood or health policy that you're interested in, we also provide action alerts that specify the bill numbers. I don't think at this point we have the capacity around one bill, but, you know, I will check with our communications department. But generally, we do categories of bills that come in action alerts, either through texting, which we just recently started this year, as well as email, and then always on our social media pages. We are on Instagram now. If you have a particular question around a bill that you want an in-depth answer to, you can always reach out to me. I do provide an update on certain bills. I have a open early childhood advocacy group that tries to meet at least once a month. But there are lots of different avenues to help you update on a particular bills.
Great, thank you.
Yeah, so we always like to end our trainings with the same quote because it is always impactful. And it's never doubt that a small group of concerned citizens can change the world. It's the only thing that ever has. And I think that is, the cornerstone of what we do and why we do it. It's not just about what Emma and I say at the legislature. It's ensuring that we're lifting up underrepresented voices and then helping others come to a place that they are interested and excited to do advocacy. So thank you today for listening to us. We hope that we provided a lot of information. I know that we covered a lot of ground, and all the slides and links will be provided to you after the training.
Great, thank you very much. As always, I came away from it learning more than when I started, and I've taken several trainings specifically with you, Rebecca, and every time I come away and I go on the website and I'm like, oh, I want to follow this and I want to follow this, and then I get all involved in it and then life gets busy again. So I need to take a training with you about every 3 weeks just to keep me on top of things.
Yeah, things change a lot, and we all need a lot of reminders.
Well, I really appreciate it. And like I said, this was recorded today. So if you enjoyed this presentation, we'll send the information out to everyone so that you can share it with your friends if that's what you'd like to do. Does anybody have any other questions before we let them go for the day? I've been trying to keep on top of things in chat. So I think we've addressed most of the questions we've gotten.
So, hi there. I always have something to ask. And I wanted to make sure that there weren't any other, questions out there. So I work on the data end with the New Hampshire Children's Trust. And so my lens is typically less around a specific issue and more from a systems perspective. So the example that I'm thinking of is I would love to be able to get New Hampshire to a place at some point where we stop introducing new data systems for every new program that comes down the pike, because it ends up at the ground level for Family Resource Center staff to have to enter data into multiple systems, which is a terrible practice. I've spoken with Dylan Gatta around all the data integration efforts that they're doing at the state level, right? Taking all these disparate pieces and making some sense out of it. And I've said to her, this is great. I love what you're doing. And understand that nothing you're doing here is helping reduce the sheer number of data platforms and data systems and the duplicate data entry that's going on. So, so my question, how this ties in, I think, or not, with the legislative advocacy is that to me seems more like a regulatory or agency determined decision when they go to implement some legislation. Is there something that you would recommend legislatively, though, to think about introducing a bill or working with a sponsor that would speak directly to data systems and the sheer number of them across departments? And right.
Yeah, so we always say investment in data is not a sexy legislative action. It doesn't always rise to the point of our legislature enjoying listening to you talk about it, quite frankly. Although I'm a data nerd and I love it and I understand. I think that the issue around data systems is complex. First of all, it comes from antiquated ideas around technology and data that have been built into programs and services that we've developed in our state, right? New Hampshire tends to seek federal grant funding to implement a pilot, and then that pilot may or may not be funded. We don't have a lot of sustainable sources. You know, often we're back at the legislature every 2 years, ensuring that we don't lose programming. Right. So what happens sometimes with that is that we don't think about the larger system. We don't think about data being integrated. I think, you know, what you said is happening with the Council for Thriving Children at looking at data integration will give us some ideas on what we need to do, whether that's regulatory or, you know, administrative, and whether some of that requires legislative action. Where I see it requiring legislative action is what I led with. I think there needs to be investment in data systems. If you think and you can reflect upon even how we have helped our home visitors during COVID and after COVID, you know, what technology did they have, you know, in meeting with parents? How did that impact their data collection, you know, internally in capacity? So I think that, number one, your concerns are 100% accurate. I think that it is not as simple as one solution, but it really probably will take all three of those working together. And if it is similar to most things in New Hampshire, you know, I look to what you guys are doing in the FSDS, right? Yep. You know, what are you doing to really tell a better story, and using that as a marker for, you know, if we had better data systems, this is what we could do. I would say there's always an opportunity to advocate for those federal ARPA dollars. Like, to what extent are they, you know, could they be used for infrastructure and change? You know, one hiccup may be with regard to federal reporting requirements. And this is where it exceeds New Hampshire's ability to problem solve everything. There are some requirements on, you know, federal grants around reporting that differ between the programs. You know, I think that would take a kind of a consultant or someone to come in to say, you know, these are the things that we could overcome. So I look to the Council for Thriving Children maybe to identify some of those gaps. But there are definitely always sponsors that would be willing to look and speak with you about, you know, how could we solve some of these data issues that we have that really hinder the capacity at our Family Resource Centers and other organizations. who we also know are on limited funding. So that probably is not a great direct answer, but that is, it is a issue that we have been thinking a lot about because as an advocate, I'm often looking for data to help tell a story, but if the data doesn't really tell a complete story, or there's so many regional variations, it gets complicated.
Right. Yeah, and actually nothing that you said is out of line with what I anticipated that you might say. So it's all, it's all good, but I appreciate, I appreciate your perspective for sure. So thank you.
Welcome.
And I have one more comment that came up to us in the chat, that PCA America celebrates Digital Advocacy Day tomorrow. They're asking their partners to urge lawmakers to reauthorize the bipartisan maternal, infant, and early childhood home visiting program. Can either of you speak to this program or a similar program in New Hampshire?
Sure, great. Yeah, that lovingly is called MICV. And MICV is a home visiting program, 3-year program, prenatal through age 3, that is in New Hampshire. It does serve a lot of New Hampshire families. It is part of our, what I like to call, portfolio of home visiting programming within New Hampshire. It is really important as it identifies new moms and provides supports prenatally, but then throughout the first 3 years. And those supports can be things like initially when you bring home a baby, breastfeeding supports, healthy eating supports, but also supports like, where do you find an educational program, financial assistance, planning, things like that. So it's really important programming. And for, fiscally minded, we have a small state investment that leverages a lot of federal dollars. So it's super important. What's going on now on the federal level is reauthorization. So that means that this is a bill that has been around, but it always has a sunset period. So they're looking to reauthorize it. If it isn't reauthorized on a federal level, then the program will cease to exist in New Hampshire. If it didn't exist in New Hampshire, then we'd have a lot of families that would go without an important service. Home visiting, if you want to tie it to my initial conversation around ACEs, is one of the interventions that we know helps mitigate the impact of adverse childhood experiences. It's also, too generational and important for our communities. So it's a priority for us. And we have worked, we don't do a lot of federal work, but we have worked with our partners in supporting reauthorization. Does that answer the question sufficiently?
I thought that was a great answer. I didn't ask it, but I thought it was a great answer. So.
Great. And there's lots of resources we can provide afterwards if you're interested. Even if you type in MICV in New Hampshire, if you're on Google, they'll provide some data around how the programming operates here and who qualifies, et cetera.
Okay, and I have one more message down here. Let's see what that is. Yeah, just talking about MICV. So yes, that Rebecca asked that question. She said it did answer that question. So
Great.
So I don't see anything else in chat. If anybody has anything, please come off of mute and ask your question. Because it's very valuable to have people in the room that know the answers. So try and ask as many questions as we can. And after this, there will be, I'm going to send out a link to everyone who registered of all of the slides that were presented today, and those have the links in them for things that were discussed today. So you will definitely be getting that. And did I hear that you guys have an evaluation that you would like completed as well?
Yes, Janet should circulate that. We have that as well.
Okay, so that will also come out in the email. So look in your email in the next half an hour or so, and I should have those things sent out and you can go in and take the evaluation. Let us know if there are any other topics around legislature or advocating that you'd like more information about. And I'm sure that we can talk Rebecca into doing this again.
Sure, as long as you'll let me speak, I'm happy to chat.
So thank you very much for coming in today and for being part of Child Abuse Prevention Month, so I appreciate that. And if we get any questions afterwards, I'll just email those over to you so that you will be able to answer them directly.
Great. Thank you so much,
Okay.
Karen. Thanks, everyone.